And now to some more on our second leading story this morning. Ivory Coast has announced its first case of the novel coronavirus while stressing that all precautionary measures are being taken. The virus was detected in an Ivorian who went to the hospital with complaints of fever and a runny nose after returning from Italy. The patient, Ivory Coast Ministry of Health says, has been quarantined and is stable. It brings the total number of coronavirus cases in Africa to 114, two of which have resulted in deaths.
Indeed, Jerry, and we know a little more about this Ivorian patient. He's said to be the coach of a football team, and he left for Italy on the 27th of February and returned on the 6th of March. He's been subjected to the usual check on the arrival at the airport, but had not been detected since he had taken paracetamol, which lowered his fever. The man and his family were placed in quarantine. Samples were taken to determine if they were also infected. This is the first confirmed case of coronavirus in Côte d'Ivoire. At the end of January, a false alarm had been issued which talked about an Ivorian student from China. The government has since put in place a response plan of 650 million CFA francs, or about 1 million euros, including the installation of 5 dedicated rooms. So how is the population reacting to this situation? We talked to the Africanews in Abidjan, Ivory for more. Hello, Ibrahim. 72 hours after the declaration of the first case of coronavirus in Côte d'Ivoire, what is the mood in the capital?
Oui, la présence du coronavirus sur le territoire.
The presence of the new coronavirus on the Ivorian territory through a person who has recently been in Italy worries the Ivorians in general. Already yesterday, we visited certain pharmacies to observe the preventive measures observed by some Ivorians, and well, I can assure you that masks and other disinfectants are out of stock. However, there's no panic in the city of Abidjan, let alone in the rest of the country. But vigilance is required. Ivorians who are used to hugging each other are beginning to obey the measures put in place by the Ivorian authorities. That means not shaking hands, avoiding physical contact, and washing their hands frequently with soap or water, or using a disinfectant gel before eating and after using the toilet after sneezing, and also maintaining a distance of 1 meter between oneself and the person who coughs and sneezes, as this distance allows you to avoid being in contact with the secretions that could contain the virus.
Brent, I'm concerned about the patient here. Can you tell us about his situation, how it's evolving, and what more do you know about the current state, his current state?
Well,
at the moment, we do not know more about the progress of the disease as concerns this first patient. He has been placed in quarantine at the Trishville University Hospital Center. However, the circumstances of his infection have been addressed by the Ivorian Minister of Health. He's a sportsman, a football coach, who contracted the virus after a trip to Italy, as I earlier mentioned. According to the minister, he allegedly passed through the health facilities at the Felix airport without being detected or being placed in quarantine because he had taken medication to calm his fever. Well, as part of the response plan, what has changed since this case was confirmed? For the time being, no communication has been made, indicating that there will be no other cases. However, the recurring reports of approximately 100 quarantined people are persistent. However, it must be said that if the fear is visible in the Ivorian population, some people find it hilarious or comical, hence the numerous comments or publications on social media networks, claiming that the country would be protected by God and would not allow such an evil to take place and destroy people's lives. Thank you, Ibrahim Bro, for all these details.